On today's podcast, you've got me, the mad scientist, and I'm coming here talking about instrument-assisted soft tissue mobilization. It is a technique that I had learned early on in school. It's very specific. It is also known as Graston technique, and I wanted to talk to you a little bit about it as it is extremely beneficial, and a lot of individuals are starting to get the tools as becoming more readily available on Amazon, and at least give you the lowdown on exactly what it's all about, how to use it, and the whys. So without further ado, from your Functionized Integrative Therapeutic Studio, here is the Functionized Podcast. Yep, this is how it goes sometimes. Edit job. Booyah. Cut it. And re-record. Alright, here we are. We'll talk about Graston a little bit here. Won't keep you too long, but I gotta say this is a fascinating idea. So Graston is a stainless steel instrument. The company Graston actually makes quite a few stainless steel instruments, has a whole kit for thousands of dollars. I have one called the Fibroblaster and the Jack. I love them. They are beveled edges on them. They German stainless steel. And there's others called the Factor. You can use a bullhorn. Pretty much anything with a beveled edge that's hard and is not going to break or impale you. Impalement, not good. Crap ton of bad times. Graston, no matter Factor, no matter what you want to call this technique, is also known as instrument-assisted soft tissue mobilization, IASTM. And it's used synonymously here, as I was saying, Graston, Factor. There's other ones called Hawk Grip, Vine, V-Y-N-E. And these are all different brands, and the style and technique is taught by different companies in different ways, but it really comes down to the same type of thing, where it is a deep cross-friction massage. When you say massage, it sounds nice. It's not necessarily. It's therapeutic, and that's a nice way for physicians to say it's going to make you feel better, but it's not going to feel good. The foundation and principle of instrument-assisted soft tissue mobilization is to break up fibrotic adhesions that cause neuromusculoskeletal restrictions. So if you think about two objects, you want them to glide past one another. And everyone watching at home, glide past one another. Now, this is your fascia, and the fascia should be nice and slippery, glide nicely, but when there's little adhesions, scar tissue starts to build up, and there's little pockets of hyaluronic acid that occur. Acid burns, stimulates the nerve endings in bad ways, and you're gonna feel pain. The movement of the body in those areas is not gonna be the same, and as a result, you're going to have dysfunction. It can be caused by an acute trauma. It can be caused by chronic use. It can be done by surgery. You may not even know what's going on, but nonetheless it occurs. And the origins of IASTM, instrument-assisted soft tissue mobilization, is not exactly new. It's grounded in the works of a man named Dr. James Cyriax, who is an English orthopedic surgeon. And IASTM has become standard protocol in many different universities and hospital-based outpatient facilities and industrial on-site treatment settings, and by the National Basketball Association, the National Hockey League, Major League Baseball. We've got the PGA, we've got soccer, many amateur sports, so many different universities, the United States Olympic Training Centers, you name it, it's being used now. What does it all mean necessarily though? And typically everybody using it means that instrument-assisted soft tissue mobilization is an excellent technique used in diagnosis and treatment of a variety of conditions that most individuals endure or even take prescription medication for instead. You take a drug, it's going to mask it, you'll feel better, but it's not actually fixing anything. Hopefully it goes away. But when one dysfunction occurs somewhere, another dysfunction is occurring elsewhere by simply masking it. Instrument-assisted soft tissue mobilization is actually a very excellent technique, and it's used in the diagnosis and treatment of a variety of conditions that most individuals are going to endure, as I had said. And it's non-invasive, which is the biggest thing. And it removes adhesions and it removes pain in a very permanent manner. Some of the common conditions, IT band syndrome, runners get this a lot. You don't have to be a runner to get it, but especially runners that go downhill often. Treating the area around the IT band, the vastus lateralis, and even some of the other quadricep muscles, vastus medialis, vastus intermedialis, can definitely help assist with IT band syndrome. Oftentimes IT band syndromes can be found as knee pain, but nobody can figure out the reason. There's no internal derangement of the knee, there's no acute trauma to the knee, no twisting and turning, no ACL, I mean, nothing's wrong with the knee. IT band pulls on the knee hard enough, you feel that almost ghost pain in the knee that you just can't describe, but it hurts. So utilizing instrument-assisted soft tissue mobilization with different points within the quadriceps breaks up the myofascial trigger points, and within the first 3 treatments typically it goes away. Plantar fasciitis is another big one, typically felt the worst when you first get up out of bed in the morning. As it warms up a little bit, it feels better, but think about the fascia covering underneath the skin in your foot. On the plantar surface, it's all crinkly. You don't want it crinkly, you want it nice and smooth so it can glide. It's going to be very painful the longer it goes on. It's excruciating. There's a baseball player that I treated a while ago, and it was on the foot that he landed with. So he had to go on the designated list, and he was just in so much pain that he couldn't play. And after a few treatments of it, he was able to get off in the 15 days and go on to have a very good season. It's something that he had for a long time, but no one ever said, hey, let's use some Graston on it. They would just give him some pills and hope it would work. It did not. Tendinoses, also known as tendinopathies, tendonitis people would call it, but there's not exactly inflammation, so it's kind of a misnomer. And any disease of the tendon which connects bone to muscle, it's typically chronic, degenerative, and not necessarily inflammatory, as I said. IASTM works by stimulating fibroblast activity within the tendons to increase proper collagen formation and increase blood flow. A lot of scar tissue formation. After injury and trauma, which I said before, including surgery, your body lays down scar tissue as part of the healing process. And however, improper movement or lack of movement, I should say, in the region results in improper collagen formation. And this leads to dysfunction and further pain. So IASTM breaks down the improper collagen formation and allows your body to heal in the proper manner, increasing blood flow and function of region of said dysfunction. And when you view it under a microscope, normal tissue, it takes a couple different fashions. You get dense, regular, elongated fibers running in the same direction, such as tendons and ligaments, or dense, irregular, and loose with fibers running in multiple directions. In either instance, when the tissue is damaged, it will heal in a haphazard pattern, which is also known as scarring, and results in restricted range of motion and often pain. So that's why it's vital to ensure normal tissue is laid down as opposed to irregular formation. Pain is not normal, peeps. Pain is not normal. It's your body's way of telling you something is wrong. Some other conditions treated with IASTM: cervical sprain strain, which means it's neck pain. Carpal tunnel syndrome. This one's a big one. IASTM and some low-level laser has helped so many individuals that do not go right to an orthopedic surgeon in getting rid of true carpal tunnel. True carpal tunnel. Not wrist pain, but when you have that numbness coming from the median nerve that passes through the carpal tunnel there, it is going to cause numbness or pain. Splint it and all, but hey, IASTM, low-level laser, first line of treatment, saves you being spliced open. Lateral Epicondylitis, tennis elbow, very painful. Typically, though, it's an overuse injury if you don't play tennis, and there's typically a spiral fascial pattern. So an expert needs to go after this as opposed to just getting on the lateral epicondyle, as a lot of people will do. I mean, I go like that to myself right now, it's tender. But then I trace down, there's that other spot, trace down here, there's another spot, trace down here, there's another spot, and I've got an entire pattern going through there. Treat the whole pattern, and come up a little bit, and you will fix lateral epicondylitis. Rotator Cuff Tendinosis, shoulder pain. Achilles Tendinosis, ankle pain. Typically with Achilles Tendon, you want to go up into the gastroc, insertion, origin insertion I should say, of the gastroc and even soleus, as those two muscles form the Achilles tendon, so it's not necessarily in the tendon itself. As I said, scar tissue, Shin Splints is a really good one. Utilizing IASTM. Everything with IASTM needs to be followed up with some type of exercise so the collagen fibers are laid down in the proper manner. So after doing IASTM, especially for shin splints, you want to do the reverse calf raises, so toe ups, even the crinkling up of newspaper in your toes, just light movements, and then definitely doing some balance work on the vibration plate. If you don't have one of them, come on over to Functionized, or you can use the blue AirX pad, also known as the Smurf pad. Lumbar sprain strain, you can utilize that. Oftentimes a chiropractic adjustment will help fix that, but sometimes there's muscles, tendons, ligaments that are also pulling on the different vertebrae, so you're going to want to ensure that they are released properly so it does not continue to sublux that vertebral segment. Talked about plantar fasciitis before, the medial epicondylitis, opposite of lateral epicondylitis. Instead of lateral, medial. Again, there's typically a spiral pattern that goes along with that. Patellofemoral Disorders, a lot of knee pain, trace it up into the quadriceps. It's typically not the patella itself. The tendons that are inserting into the patella, trace them up a little bit, and that's typically where you find your dysfunction. In the show notes, there's actually some photos of that exact condition being worked on. You also have fibromyalgia. Typically people who are more active, the symptoms of fibromyalgia dissipate. Trigger finger and even post-mastectomy and C-section scarring is great using IASTM to break up those adhesions. What happens afterwards? You're going to love it in the show notes. Bruising, swelling. You will have petechiae. Sometimes it can be really deep and it looks like you were into a traumatic motor vehicle accident. Not the case. It's normal. It's just there is some capillaries that are forming around the scar tissue because blood flow still needs to get through. So by breaking the scar tissue, you're breaking down those capillary beds and they're going to reform in the proper manner. Much healthier for you. It's okay. It's part of the normal healing process, and none of your physical activities are going to be limited as a result. So that is the in-depth, very brief description of instrument-assisted soft tissue mobilization. It's not actually used with the company Graston or Factor. I want to thank you for being with us on this quick, short little podcast talking about instrument-assisted soft tissue mobilization. While you can get the tools online and on Amazon, I highly, highly, highly suggest that you go to a trained professional who has been trained to diagnose and understand the dysfunction, where it's at, how it works, and the proper treatment protocol typically involves some type of warm-up and ending up with some ice massage, but I like using laser also in this case here with some movement. But that's just me. Team functionized, we're coming together, the gear is out. We're going up on the website very soon, so check on the website if you'd like to purchase your gear. If you are a Team Functionized member, you're receiving your gear as a courtesy just for being awesome, showing up to life every day and crushing it. Thank you for trusting us, and we will continue to deliver the absolute best at all times to you. This is your mad scientist, Jim, reminding you to check out our Instagram, check out our Facebook, send your questions in the direct messages, and thank you again for being here. So, I am out.